Another positive case of the coronavirus has been recorded on St. Kitts and Nevis. This time, the patient is a frontline worker who was tending to the newest case of the coronavirus recorded last week, according to Health Minister Akila Barron Nisbet.
Today, Friday 10th July 2020, St. Kitts and Nevis recorded one additional case of COVID-19. This brings the total number of confirmed cases to 17. The patient is a frontline healthcare worker who would have provided care to the previously announced case. Now that confirmation of COVID-19 has been received, the patient is subjected to mandatory isolation in order to limit the likelihood of transmission to others. All the contacts of the patient would be subject to strict quarantine and testing.
SK Newsline asked health authorities at the NEOC press briefing Friday whether the frontline worker who contracted the virus was wearing personal protective equipment, PPE, when tending to the COVID-19 patient, and what level of protection is offered by PPEs. Chief of Staff of the JNF General Hospital is Dr. Cameron Wilkinson.
What I can say is that at all of our institutions, anyone who is coming into contact with any suspect case of COVID-19, they are properly donned. That is, they have the necessary personal protective equipment. And so the person in question, I would assume that they would have had that, because once persons are working on the COVID section of or the respiratory section of the emergency room, all those persons are properly donned. Now, what is the level of protection? There are a number of studies that were done worldwide, and one of them is the Cochrane study, where it shows that physicians or healthcare workers who are properly attired, the risk of contracting COVID-19 or any infectious disease is significantly decreased, and therefore we're saying then that these personal protective equipment, they provide proper protection against the virus. That's one of the reasons why persons who are working around COVID-19 patients, they don't necessarily have to be quarantined. They can don, that is, put on the equipment and doff, take them off, and then go home or go into society and mingle normally. Now, where a problem occurs, and not necessarily speaking about this case, but as it relates to healthcare workers, when they do get infection, despite the fact that they were wearing the PPEs, it has to do with sometimes a break in the technique of putting on and taking off, most often taking off the equipment, because you can swab someone, you can have somebody who was coughing around you, etc., and the outer aspect of your dress becomes contaminated, and if you take off that in an improper way, then you can contaminate yourself. And it's important, therefore, for us to always do retraining of persons as it relates to donning and doffing, to make sure that we don't have any break in the techniques.
The latest coronavirus case brings to 17 positive cases recorded on St. Kitts and Nevis, 15 of which have recovered. Andre Huey, SKN Newsline.